Welcome back to part 2 of Composite Excellence with Dr. Javier Quirós. Now, usually I start the podcast by saying, hello, Protrusive, I'm Jazz Gulati. Now, I had someone message me the other day on the podcast page, say, Jazz, what does it mean if you're a Protrusive? I don't get it. So on that note, welcome to any new listeners and new watchers. It's great to have you. A Protrusive is a dentist who listens to his podcast, but then finds himself scrolling and then listening back to the old podcast that they haven't listened to before, and suddenly you've binged a lot of the episodes, and therefore now you are a loved Protrusive. It means that you're passionate about dentistry, or you want to be passionate about dentistry, and you like tangible, productive tips and pearls to help you on Monday morning. So what I like to do with the podcast and what it's evolved to become is a fun way to share. And I'm hoping that most of the episodes you listen to aren't boring, and there's a bit of humor or lightheartedness, and we discuss real world dentistry or tips and themes that are really relevant and you can apply on Monday morning. So in this part 2, you're in for a treat. Like, if you remember the 3 episodes we did with Dr. Devang Patel, scroll back and listen if you haven't already. They were on adhesive full mouth rehabs in 3 episodes. So how to do from right at the beginning, 11 appointments, from 0 to 11 appointments over 3 episodes, how to do adhesive full mouth rehabilitations. So as we got more and more towards part 3, it became more clinical, it became more procedural. And to this episode is no exception. So Dr. Javier Quirós becomes a bit more procedural in this episode into the nitty gritty. So in this episode, Dr. Quirós covers interproximal management of composites. I left you on a bit of a cliffhanger last time, if you remember. Talk about isolation. Is it always necessary to use rubber dam or even split dam or Optigate? Like, personally, for a lot of anterior bonding, I like to use the Optigate. For my posterior, especially lowers, I will use rubber dam. Lower incisors, I'll definitely use rubber dam. So for me, it's variable and depends on the patient very much. So let's see what Dr. Quirós has to say about that. Preventing stains. That's a huge one, right? So you'll hear from him what the protocols are to prevent stains on your composites, and the 5 Ps of composite veneers. This episode, once again, is kindly sponsored by Enlightened Smiles, who also are the ones that sell the KC instrument, which I talked about in part 1. So in the UK, they distribute, otherwise Cosmodent products are brilliant. So if you're in the US, go to Cosmodent. If you're in the UK, if you want the Cosmodent products, you go to Enlighten, and it's Enlighten who's sponsoring this podcast. So do show their support for supporting me. Every episode, as you remember, I give you a protrusive dental pearl, and for this episode, I've got a really good one. I need to pay homage to Dr. Pasquale Venuti, the Don Pasquale Venuti, and Dr. Marco Maialino. These are both amazing dentists from Italy. In fact, I have a whole series with Dr. Pasquale Venuti coming very soon in a couple of episodes' time. It takes a long time to edit some of these episodes, so Pasquale's is brilliant. I want to do it justice, so please hang tight and wait for this epic amount of educational goodness coming your way from Pasquale. But one of the things I learned from their vertical course online, so VertiPreps online, I've done VertiPrep courses with 3 different educators now. So Andre Cardoso, Portugal, Jason Smithson, UK, and the Italians, Pasquale Venuti and Marco Maialino. I am biased towards vertical preparations. I still do the odd horizontal, and I do lots of onlays, but for a lot of crowns, I will do vertical preparation. So one thing I learned from that course, and it's like one of those tips that you think, wait, why didn't anyone show me this before? And maybe you guys already know it, I don't know, but I'd love to share this with you. So let's say you are making a direct temporary crown using a bisacryl material, Luxatemp, Integrity, ProTemp, you name it, right? So you fill in your putty, and then you make the temporary crown, and then you take it out, and then you trim it with a soft flex or diamond to make sure it seats on perfectly. Now, a lot of the time, when you are polishing or adjusting the interproximal, mesial or distal, let's say single crown, mesial, distal contact areas, you're trying to make sure that you can reinsert the crown, right? Because if you can't get the crown back in, then you have to do some adjustment interproximally. So you do some adjustment, and now you find that, yes, the crown, your temporary crown, is seating fully, and it might be happy in the bite, etc. But now there's an open contact mesially and distally. Now, yeah, hopefully there's enough occlusal stability that the adjacent teeth will not tilt into the area, but we really miss out on a big benefit of having nice tight contacts on our temporary crowns, because temporary crowns, well, they're temporary. Okay, and they can come away. So, your patient goes away for a few weeks, comes back. I can hear all the CEREC dentists laughing at me now. But anyway, your patient comes back, and sometimes, the temporary crown is lost, and it's not nice. We want our patients to keep their temporary crowns in their mouth. That's the whole point of giving them a temporary crown. So if you have an open contact, mesial, distal, or mesial and distal, then you lose some retention in a way, right? When it's nicely snug against the adjacent teeth, it is much more secure. But when you have open contacts, it's relying so much more on the cement, on the resistance and retention form of that crown. So how can we, this is the real tip now, how can we polish our temporary crowns, but at the same time ensure we don't over polish and end up with open contact? So this is gonna blow your mind, because I was like, what the hell? Why is it so simple? Why didn't anyone teach me this before? So maybe it's just me. So when you take out your bisacryl temporary and you just about prise it out, sometimes maybe you get a flat plastic and you bring it out. Now the first thing I would do is I will get either a Sharpie pen or an indelible pencil and color in a small circle, maybe about 2-3 millimeters mesial and distal, okay, of where my contact area is, where it's contacting the mesial and the distal tooth. Now that I've colored that in, I'm not going to touch that, i.e. I'm going to do my soft flexing, diamond burring, acrylic burring, whatever, however you want to polish your temporary, I will do it, but I will not touch that penciled mark. So now you've got a nice trimmed polished temporary, but you've got a contact area that's preserved mesially and distally, which is brilliant, because now you've got a nice tight snug fit that's not overly tight, but it's nice and smooth as well. So this is my big tip passed on from these Italian guys. Such a simple one. I hope you use it. Like, please use it. Like, next time you do a temporary crown, do it, because it makes so much sense and you'll see, wow, why didn't anyone teach me before? So like I said, maybe you already know this, but I didn't. Let's join Dr. Javier Quirós and I'll catch you in the outro. Because something that we've discussed on our Protrusive Dental Community Facebook group many times, which is interproximal management. I'm a Mylar pull kind of guy, and I know I went to see Pascal Magnier in Edinburgh recently. He is a big fan of PTFE and just taking the composite right up to the PTFE, and he's some sort of wizard like that. What is your recommendation? What is your protocol for interproximal management to prevent the composites being stuck together and getting the nice, smooth, flossable interproximal surfaces?
Well, yes, I love the pull-through technique. And the pull-through technique, it was taught to me by Corky Wilhite at Chicago CEE. And is such a great technique that I use it every day. So what we do, let me show you right here.
If you show it and then you describe it for the listeners as well.
Yes, I'm showing a video here for those YouTube fans. You place first the incisal edges with the microhybrid, okay, like I showed you before. And then whenever you're going to close a gap or a diastema, then you put a Mylar strip. Then you do a little sausage of composite in between your fingers. Remember, you have to have in between your fingers the anatomy that you want to bring. If you want to bring a contact, you have to do it in your fingers before you put it in the mouth. You cannot put it in the mouth and expect to become something. You have to do it in your fingers with very clean gloves and then put it in the mouth, okay? And then you put it on the Mylar strip. And as you can see there in the video, you pull lingually. And then that composite will go in between each tooth. And then you take off any excess with your IPC thing instrument, and then you put back your Mylar strip. And then you can light cure it. And you're gonna get a very strong and durable contact in anterior teeth, okay? And that's called the Mylar pull technique. And I use it every day, and it gives me great results. You know, whenever you're getting stains in between teeth because in your composites, it's because you're not getting your composite all the way to the contact. You're just leaving your composites shy to the contact, and then you will see that line or that stain in between your teeth. And whenever you do this technique, then the composite will go all the way to the contact, and it's going to give you a much color stable composite veneer, but it also is going to give you a tight contact, so you will not get food in between your teeth. I mean, that's the best way to do it, and it's called the Mylar pull technique.
We've talked about it before, and I'll add a link again to some of the videos that we've shared before about this technique. And yeah, I'm a big fan. Just wanted to hear what you thought about that technique. And sounds like obviously you're a big fan as well.
Yes.
Now the floor is really ours in terms of where we're going to take the rest of this episode. Are there any key points to get great results? And you've got finishing and polishing there, which is such a huge part of everything we do. What are the gems that you want to share with the Protruserati now?
Okay, so the 5 Ps of composite success is 5 Ps. The first is patient. make sure you pick the right patient for composites. If your patient is a smoker, if your patient tells you, doc, I will never get my teeth clean, I just want my veneers and get out of here, then you go for porcelain. Don't go for composite, But if you have a patient that has great or good oral hygiene, then you can go with composite every single day. Your patients that you already have in your office, they come every 6 months. Those are your perfect patients for composite veneers. Then preparation and isolation. Make sure you use a rubber dam. It's so important to isolate. It's maybe 90% of your success is because of your isolation. Then the number 3.
Just want to stop your isolation, if you don't mind, Javier, because those who are listening may not have seen the cases you are sharing. It sounds or it looks like that you are preferentially going towards split dam technique, because obviously when you're doing veneers all the way up to the gingival margin, it's very difficult to actually go a normal full rubber dam. So am I right saying that you're doing split dam technique?
I do split dam technique because I don't like to do individually and then go clamp by clamp, because I sometimes get bleeding and I'm not, like I told you, I'm not such an agile dentist. So I do split dam technique, and I'm showing a video here on how I do it. And it only takes me 2 minutes to place it. And you know what I do in the posterior? Then I close it with a putty in the palate so that I will get total isolation. But I'll have a great area where I can work with. And it's amazing the amount of isolation that you can get with an open or split dam technique. But as I'm showing here, you can always close the back of your palate with putty. And that gives you total isolation, Jazz. And oh my God, I keep fighting, I keep fighting with my associates. I'm walking in the hall and I see somebody doing bonding without a rubber dam. I freak out, Jazz. I'm such a control freak.
Me too, we're the same. I can't do any adhesive dentistry without dam.
And I used to fight the tongue and fight the cheek. And, now it takes me 2 minutes to place the rubber dam, because we developed that practice. And those 2 minutes save me like half an hour in every procedure. And I used to do a lot of porcelain inlays. And, the ones that I cemented with other rubber dam on, you can always see that line on the inlay, a year afterwards, like you have adhesion, but not good adhesion. Those patients that I put a rubber dam and I bond with a rubber dam, you could not even tell where the line of the inlay is at, You get total bonding when you have total isolation. So I definitely recommend you guys, if you have to take a CE course, Jazz, you and I have talked about before which CE courses should we take. And, it sounds very basic, but take a course on isolation. I have learned so much on those courses on isolation, and my dentistry has gone from mediocre or medium to top dentistry because of rubber dam techniques. So
100% agree. And I just want to comment on one thing I just saw in your video, which I don't do, but I'm totally going to do now, is that random tissue that you put underneath the rubber dam.
Yes.
I mean, I don't know why I don't do that. I mean, this sounds like an obvious thing to do, but I'm going to start doing that. So is it just like a normal?
It's a napkin. It's a tissue paper, Jazz. Yes.
And you just cut one corner when it's folded, and then it becomes a big circle. Yeah.
Yes. I love that. You know what? I used to, there it is in the screen. So for those YouTubers, you can see it right there. My patients, whenever I took off the rubber dam, most of them have some kind of allergy to latex. So then they have this rash all in their faces, and they're uncomfortable while I'm doing this. And I've been doing this for maybe 10 years. I cut a napkin and I make a hole in it, and then I put it underneath the rubber dam. And then when I'm finished, they don't have any problems on allergies and all that. So whenever your patients tell you, I'm very sensitive to latex, this is a great technique.
Awesome.
Yes,
Thank you.
yes,
Please, back to the 5P. Sorry for interjecting.
Yeah, the polymerization, Jazz, those $75 eBay curing lights will not do for you. Don't you agree?
Who would have thought? Who would have thunk it?
We're all tempted to buy those $75 curing lights, but you need first of all, those expensive curing lights, they have all the wavelengths that you need for every single material, either if it's dual cure or light cure or any material that needs a light. So, Velo is a great curing light. 3M, the new one, is a great curing light. Blue Face by Ivoclar is a great curing light. All those curing lights, I'm sorry to say, they're expensive. You need to have them, at least one in your office. Why? Because then you can layer and cure for 5 seconds, layer and cure for 5 seconds, and then at the end, you light cure for 40 seconds per surface at the very end with this high power curing lights. And then when you polish up these veneers, you're gonna notice the difference between well cured composite veneers and poorly cured composite veneers. So if you have one of those, or if you still have your curing light from dental school, it's time to upgrade.
I'm actually a big fan of testing. I actually, now and again, I will test my light cure. So I'm a Velo user, and I went around testing. So we have the main brands, the 3M one, the Velo, which is good. But if you test a cheapy light cure on this tester I have, the wavelength, the power is way lower, and you can notice it on these testers as well. So great point, well made.
Yeah, curing lights, is not a big deal. I also try to get rid of totally of the oxygen inhibitor layer at the end. So I put some glycerin around my veneers at the very end. Once I cure them, I put some glycerin and then I cure them again, and then I find out that I get less staining in between teeth, and I get better polishing because I got rid from the beginning to the oxygen inhibitor layer, Jazz. I don't know if you do that or if you
Yep.
We
use the KY jelly, good old Amazon bought KY jelly. Just make sure your nurse doesn't call it KY jelly. But yes, we use the K gel as we call it, and cure over that, and definitely all those reasons. The polishability, the full cure is worth it.
So the number 5 P of composite veneers is polishing. So you have 2 steps. The first step is finishing, and you're gonna finish your veneers first. I use a brush at the end with my microfill composite. I place it with my IPC, and then I use a brush. Why the brush? Because the brush will give me a very, very close surface to what I want to achieve, and you can see it here on the screen. And that brush makes the tooth smooth. But then I go ahead and take my ET burrs. They are blade carbide burrs. I have 9 blades and 12 blades. I go with the 9 blades first, and then I start with the finishing procedure, which is taking care of all the lines and make sure that you give some good anatomy to those veneers. When I finish my veneers,
what speed are you using this at? So you got the carbide burr. What speed?
At the beginning, very low speeds. Maybe 3,000 RPM, something like that. Very low. Okay. And then as much as I go, I go higher, and at the end I go very high revs. So if you guys are looking at the video, you can see that I already have my line angles achieved with my microfill composite and with the brush. So I tried to be very close with my anatomy with the placing and layering, so that when I finish, I only do very minimal adjustments. So I start with my ET burrs, and sometimes if I wanna have some kind of texture, I use a fine grain diamond. Okay, and I use the 9 blades and the 12 blades. And then the last step of finishing is my coarse disc, which in the Flexi discs by Cosmodent is the blue one. I think on the 3M discs is the brown one. And then you start taking off all the lines. You start getting rid of all the little holes and the things that shouldn't be there. And at that moment, if you see a little spot, like a little hole, or sometimes you see a piece of dust, then you go ahead and take a diamond, take it out, put some bonding resin. Do not cure the bonding resin, and put some more composite on top of it, and then finish polishing it, because you don't want to have those mistakes showing up at the end. Okay, This is the last step of finishing. It's called finishing because you're making sure that you have the right anatomy and the right texture. Once you're done with this blue disc, which is the coarse disc or brown disc, Then you go ahead and keep going to other discs. This is like polishing wood. If you polish wood and they tell you, you have to use all the grits to get the right amount of shyness on your wood, and you skip a step, then it will not look good at the end. You have to go through every single disc to make sure that at the end you get a beautiful, beautiful glassy looking veneer, which is what you want, so it will not get stained. And that's what patients want, because they will look shiny. And that polishing ability of the microfill composite will keep your veneers from staining. So if your patients come to your office every 6 months or once a year, when you look at them, they are not dull. They're still shiny, and it's because of this procedure of taking the blue disc, then the yellow disc, then the pink disc. Then what we use at the very end, we use a aluminum oxide paste with a buff, and you go through them first at very low reps, and then with water at very high reps, but with water, because you don't want to overheat your composite.
How do you stop the water from splattering everywhere?
I place napkins on my patients' eyes, and I put some glasses, and yes, it's messy. It's messy, and I tell my patients, I'm giving you a second shower today, but it's worth it, because then you get beautiful, like I tell you, surface on your composite, and you know what? You can control the glazing on your composite. You cannot control the glazing on your veneers. Sometimes on your porcelain veneers, you get that grainy looking veneer that tells you immediately that it's porcelain, that it's not enamel. And you can control that by polishing your composite veneers to make it look like enamel, which sometimes if your lab technician didn't do a very good job, then the texture of the ceramic will look artificial, will look grainy. And that's something that I found out that is very hard to control. Nowadays, with the new points and cups that you have for polishing zirconia and Emax, you can get better polished ceramic than before, but it's still harder to do than when you do composite.
You're relying a lot on the lab again, basically.
By far easier to polish than porcelain.
Amazing.
So those are the 5 Ps of composite success. Like I told you, I always do the smile design first, then the wax up, then I transfer it, the wax up with the matrices to my patient's mouth, and then I layer freehand the buccal part with microfill composite, and then we polish. And we can go I use that technique every single day, Jazz. We can do that technique for a class 4 or to close a diastema, or we can do that technique with also a full mouth rehab of 28 teeth. So it's something that we use every single day. And nowadays with digital dentistry, we first digitally design it and then print it out, and then you make your matrices on printed models as well. So like I told you, you can do it both ways, either analog
the workflow
or
digitally is very exciting. Now, before I ask you where we can learn more from you and how we can reach out more to you, I just want to touch on one thing which you piqued my interest at. You said with the digital, you're doing the digital Facebow transfer. Now, please tell me about that, because the way I do a lot of my dentistry when I'm doing digital is I record my bite at the desired OVD in the arc of centric relation, and then I rely a lot on the photos, and I tell my technician, okay, lengthen this tooth by 1 millimeter, lengthen this tooth by 1.5 millimeter, based on the facial photos and the side photos. So they pretty much have a digital patient, but quite often I will not do a Facebow transfer. I will get the patient in temporaries, and then I'm happy to adjust their temporaries, and then many months later I will then convert to ceramic based on using the TMJ as the articulator. But my experience of using an actual digital Facebow transfer, please tell me more about that.
Oh, sure. Whenever I have a case, I do digital DSD, and the DSD is just a great way to make sure that your patient, first of all, see what they need, and also it's a great tool for your lab technician. As you can see here, I have this app which is called Smile Design Pro, which I use it every day. And it gives me the plane of occlusion and it compares it with the bipupillary line. So I showed this to my lab technician, and this gives me my anterior tilting position of my smile compared to my patient's eyes, which is the static part that you need a Facebow. The functional part that you need, why you need a Facebow, is because you need that arc of closure, Jazz. And I've heard it on your podcast a lot of times, which is so true. Every time that you're doing posterior teeth and you don't use a Facebow, you're running the risk of they being very high. That's why little hinge articulators are so small, so that angle is very small, is smaller than your head, and so that you never get a high occlusion. Whenever you have a semi-adjustable articulator, they are exactly the same size as a head, so that you get, with the Facebow transfer, that arc of closure, so you will get a good bite. Okay, so I can do it either with I use Dana articulators, just like Dr. Patel. I think Dr. Patel uses Dana as well.
Yes, he does. Yep.
Yes, we love Danas here.
But so you're mixing digital with analog, right? So you're taking an analog Dana Facebow and you're just adding it to the printed models, right?
Yes, exactly. With my digital smile design, Jazz. Okay. But if you want to, you can also use a Fox plane, Jazz. You can put it on your patient with some putty, and you scan that Fox plane, and then you take it, you send that to your lab technician. A scan of the Fox plane, and so they will have that with a putty matrix, so that they can see that. The big problem that we have now with digital dentistry is that most lab technicians don't know. You tell them about the plane of occlusion, and they don't understand that. And that's where we have to educate our lab technicians so that they can take in our digital scans, but make sure that they also follow our instructions with what a Facebow would do.
Amazing. Javier, you've answered so many big questions. We can talk for days about this, right? There's so many nuances.
Yes.
Where can we learn more from you? Look, I know you do some education as well. You're just very experienced. How can we learn more? All the Protrusive who've really enjoyed your presentation, where can we learn more from you, my friend?
Well, I told you, I learned a lot at school, but a lot on CE. Continuing education is the basis of every single dentist. And, I took all the courses from Cosmedent in Chicago. It's at cosmedent.com, Jazz. My Instagram account is Javier Quirós DDS. And you can see my courses that I teach at Cosmedent. Now I'm so proud of being one of their instructors. I would never dreamed to be with such a great team of people. Go to cosmedent.com and go to courses, continuing education courses, and you can see the courses that I teach there. We teach a course on full mouth rehab. We teach a course on posterior restorations. And the one that we are going to teach next is called Become a Cosmetic Dentist with Composite Resin Veneers, Jazz. And thank you very much for this timing. If you have any more questions, I'll be more than glad to.
Amazing. Well, I think it's great that you credited your mentors early on, and you said, you learned so much from Cosmedent. And it's amazing to go that full circle again and then be able to give back via Cosmedent. Lovely photo there. Is that Bud Mopper or is that Corky Wilhite?
This is Buddy Mopper with me 30 years ago. This is 1993. And
looks so baby-faced.
He was my instructor. He was my instructor at Baylor College of Dentistry when I was taking their PROS program, and that's where I learned how to.
He would have had a huge influence on you. Every guest I speak to, when you go back in their story and why they do the type of dentistry that individual dentist does, you find along the way that they were at a clinic where the dentist loved complete dentures, or they were taught by this person who's known for this thing, and then the influence just carries on. It's like having a great teacher. It's like having a great maths teacher and then pursuing maths for the rest of your life.
Exactly. That's another thing that I can tell young dentists that are listening. Please find a mentor. Dr. Mopper is one of my mentors. Dr. Raul Benavides from Mexico is another one. And you can find so many of them. Dr. Mopper taught me. He sat down with me and hold my hand. Can you believe he did that? He held my hand to teach me how to make a tooth. And it was such a lucky break for me that 30 years later, I'm teaching and I'm trying to give back a little bit of what he taught me.
Amazing. Well, you make your own luck,
Yes.
and you put yourself in those positions, and I'm a
That's
huge fan of
true.
everything you do. So I'll put the link in the show
That's
notes
true.
for Cosmoden. I don't know if you noticed, but this podcast is actually very kindly sponsored by Enlightened Smiles, and they're the sole distributors of
Yes.
Cosmoden products in the UK as well, which is a great little marriage here. So a little plug for them. Always appreciate their support. There we have it, guys. Thank you so much for listening all the way to the end. Listen, if you found value from this episode, please thank Dr. Javier Quirós. Check out his content, check out his courses. But also, if generally you are quite liking the Protrusive podcast, it really helps, the podcast if you, on Spotify or on Apple, leave a review. It really means a lot to me. I read every single one. So thank you so much for listening all the way to the end. You are a true Protruserati. I'll catch you. The next episode is Carlos Sanchez. It might be that one, or it might be Ask Jazz. We'll see how it goes for timing, because my brother-in-law is getting married soon, so times, it gets a little bit busy sometimes. So we're going to do additive equilibration with Dr. Carlos Sanchez. We'll do an Ask Jazz, and then the big one with Pasquale Venuti. So much good stuff to look forward to. Thank you so much, and I'll catch you soon.